indoors in public if you're in an area with high transmission. And people who have health conditions or taking medications that weaken their immune system may not be fully protected even if they're vaccinated, I should say. So they should continue to take all precautions that are recommended for unvaccinated people. And that's how that they can stay safe, and that includes wearing a well-fitted mask until advised otherwise by their health care provider. And I am very mindful that here we are towards the end of October. We're approaching holiday season where we have Thanksgiving, Christmas, and New Year's, and we all remember what happened last year. So people need to start planning now for a safe holiday season. And you know, that means doing things outdoors if you can. If you're one of these people need to be masked indoors, please make sure that you're masked. And of course, everyone has time from right now to be fully vaccinated before Christmas. So even if for whatever reason you haven't chosen to do so before now, you can be vaccinated and be fully vaccinated before Christmas. More than 2 million, in fact, 2.5 million people, more than 2 million are fully vaccinated. More than 2.5 million people have received at least one dose of a vaccine. And there's been a total of 4.75 million doses administered in the state of Louisiana. And Dr. Cantor is going to speak in just a moment about the booster shots that are now available for those who are eligible. I was able to get my booster shot a couple of weeks ago. Feel great. Did immediately afterwards too. So these numbers are progress, but as I've said before, not nearly enough. We are not where we should be. I think we're about 45th in the country of the 50 states right now in terms of vaccination uptake. We really need to do better than that if we want to protect ourselves, our families, one another, and make sure that we don't lose ground again to a surge should that happen in the future. With respect to K through 12 schools, you know, I got questions, you know, how could people go into Tiger Stadium without a mask? Well, for one thing, it was outdoors. Or grocery, now they can be able to go in the grocery store without wearing one and still have to wear one in schools unless they choose to opt out. And there's some differences there. And the reason that I'm encouraging school districts to continue to have the mask mandate in place, especially if they were in parishes with high transmission, is because you can choose whether or not you take your child to the grocery store or to Tiger Stadium, but they have to be in school. And we know that many of our children can't yet be vaccinated, although we've got our fingers crossed that within the next couple of weeks, vaccines will be available for children 5 and older. And if that happens, then virtually the entire K through 12 population will be eligible. But I wanted to give school districts some flexibility on the matter, some additional autonomy to reflect the improving numbers and the low baseline numbers, which is why we're adding the ability to opt out if proper quarantine guidelines are implemented. And I think everyone should be mindful that Louisiana has been a leader in the country when it came to bringing kids safely back into the classroom. We did it earlier than most states. We did it in a larger number than most states. And they've done that largely by following the public health guidance, including on masking and quarantines. And so I continue to urge school districts to pay attention to the public health experts on these matters. But again, I do believe it's time to give schools more autonomy to reflect where we are in terms of those baseline numbers. I want to go ahead now, I think, and ask Dr. Cantor to come up He's got some information about boosters and other things. Please ask questions of him while he's up here. And then I'll come back up and discuss one other topic, and then I will take your questions as well. Dr. Cantor?
Good afternoon. Thank you, Governor. On behalf of myself, Dr. Phillips, and the Department of Health, we thank you again for your leadership throughout this pandemic, and particularly the fourth surge. We, in the past couple times that we have chatted, we noted the encouraging trends, but the remaining elevated risks that existed throughout Louisiana, and that if we had continue on those trends for some more time, would be in a better place. I do think that it's safe to say that we are in a much better place now than we were 1 or 2 months ago. I'm going to walk through the graphs you see right there like we do normally. But, in a nutshell, this Delta surge, this fourth surge, was by a large degree the worst one that we had, both in number of people getting sick, number of people getting hospitalized, the number of people dying. But we have now essentially come down to the point that we were at the dawn of this surge, essentially recovered the losses that we suffered during the surge in terms of number of people getting sick and hospitalizations. So all of that is very, very encouraging. As the governor said, this pandemic is not over. And the pandemic is in charge of that, not us. But we have made remarkable progress over the past 8 or so weeks recovering from this surge, and transmission is reduced substantially throughout the state from what it was at the peak of this surge. I'll spend a couple of minutes going through the data that we are looking at right now and that helped inform the governor's decision to relax the mask mandate throughout the state. On the top left, you'll see a graph showing COVID-like illness. This is the percent of ER visits across the state that are attributable to patients with symptoms suggestive of COVID. You'll note we had 4 distinct surges. That last one, all the way on the right, was clearly the largest. We peaked the first week of August there with 19% of all ER visits being attributable to COVID-like symptoms. That's a giant percentage, considering all the other diseases out there that people seek care for. That number is now down to 1.7%, which is very, very encouraging. On the top right graph, you'll see incidence or new cases diagnosed. This is the number of new cases or positive tests in unique individuals that get diagnosed each day. Over 100,000 populations smoothed out over a 7-day rolling average. You'll note that we peaked again around the first week of August 5th or so, at 116 cases per 100,000 residents per day. And we had remarked at that time that the CDC's benchmark for the highest possible community transmission is if you have over 100 tests per 100,000 residents per week. And we peaked over 100 per day. We've come down consistently. We're now at 8.9 new cases per 100,000 residents per day, which is reassuring, no question about that. On the bottom left, you'll see the combination graph. The orange bars on the bottom are percent positivity. Percent positivity right now is at 2.7%. And we have a new number that comes out every Wednesday. And I do anticipate that will fall even more tomorrow, seeing the numbers that have come in over the past couple days. At the peak of this surge, around that first week of August, we peaked at 16.1% positivity. That's 16.1% of all tests conducted were positive. And that was the highest that we had gotten to at any point in time in the pandemic after that first surge. And in that first surge in March and April 2020, our percent positivity was artificially inflated because we were barely doing any testing. You had to be really sick to get tested in the first place. So to peak at 16 and now to come down to 2.7% is encouraging. I'll tell you right now, there are no parishes in the state that have above 10% positivity. There's only 11 parishes that have between 5 and 10% positivity, and there's 53 parishes that have below 5% positivity. And I expect all those numbers are going to get better tomorrow when the revised data set comes out. What gives me even more confidence in that is that purple line, which is testing volume. And as the governor has remarked a couple times over this surge, we are doing considerably more testing volume than we have at other points in the pandemic. And that's thanks to the hard work of our National Guard colleagues, of the Department of Health, and many other individuals who worked hard to continue to provide testing opportunities for people across Louisiana. Right now, we're testing at about 250 tests per 10,000 residents over a week period, and that's a decently substantial number. We're on track to have about 700,000 tests conducted in the month of October. So all of that is encouraging in that it gives us confidence in these numbers. The more testing you're doing, the more visibility you have on the pandemic. So with that much testing happening, I feel confident that the numbers that we're looking at now are accurately reflective of a decreasing community transmission risk throughout the state. On the bottom right, you'll see the graph that we spend the most time worried about, and this is the number of COVID-positive patients hospitalized at any point in time in hospital beds throughout the state. Today we're at 323, as the governor said, and that's down from over 3,000 at this peak. We're down, you can see in that graph in the bottom right, we're pretty much where we were when this surge started. There was about a 3-month period before this surge where we plateaued right around 300, 315. And that's about where we are now. So we've regained all that lost hospital capacity, and we're very thankful for that. If you look at the CDC's community transmission risk scale, there's 4 categories from low to highest community transmission risk. As it stands right now, there's 18 parishes. In that highest category, there's 39 parishes. In that third category, there's 7 parishes. In that second category, and no parishes in the lowest risk category. I do expect each of those metrics, again, to get better tomorrow when the new weekly data set comes out. All of that is reassuring. And if you take a step back and look at the national picture, the Delta wave is clearly moving to other parts of the country, out west, up north a little bit. We are in a much better position than many other states right now. And if you compare our data to other states right now, at this moment, we have less new cases day by day than the national average. We have a lower percent positivity than the national average. We have less people being admitted to the hospital day by day than the national average. And we have less people in the hospital with COVID at any point in time than the national average. All of that is reassuring. I'll tell you, we still unfortunately have more deaths per capita day by day than the national average, and that's reflective of the relatively low health metrics that Louisiana has that predates COVID. We unfortunately have a lot of comorbidities in the state, but in terms of the transmission of this virus, we're doing better than the national averages right now. All of that is very reassuring. I want to talk briefly about quarantine guidance in the K through 12 educational setting for a second. As the governor noted, we were a national leader, continue to be, in bringing children back into the classroom setting early and doing it in a manner that's safe. And the way that we were able to do that was simple. It was simply following the best evidence-based guidance that public health has to offer. We show that you can bring kids back into the school setting and do it well and do it safely. And a lot of states have followed our model. I want to review quickly what the quarantine guidance is and tell you why this is important. It's important because the novel thing with COVID compared to other respiratory viruses is the degree of asymptomatic transmission. Unfortunately with COVID, and we know this now after 18, 19 months of the pandemic, it's not enough just to say, if you're feeling sick, stay home. I mean, you do need to stay home if you're feeling sick, but that's not enough because 50% of people who are COVID positive and able to spread that virus to other people have absolutely no symptoms. So they have no idea that they're infectious. So you can't just say, if you're sick, stay home. That's why quarantine is important. Quarantine means if I'm exposed, if someone tells me, hey, I was positive and they were close to me, so I was exposed, the only way I can keep those around me safe is if I quarantine and take myself out of the picture for 10 days or so. Because I might turn positive, I might become infectious, and I would have no idea because I could be asymptomatic. That's why quarantine is important. And it's even more important in a school environment because you're sitting next to people for 7 or 8 hours a day, and you're required by law to be there. And we want families to feel safe sending their kids to school. So I'll review real quickly what the quarantine guidance is, and this is by the CDC, and we wholeheartedly agree with it. If you were within 6 feet of someone for a cumulative 15 minutes or more, you should quarantine unless you are fully vaccinated. If you're fully vaccinated and you have no symptoms, you don't have to quarantine. If you have tested positive for COVID in the past 90 days, you don't have to quarantine. If in the school environment, both parties, the person who was positive and the person who was exposed, were wearing masks and wearing them correctly, they don't have to quarantine unless they're within 3 feet of people. So that already reduces the number of people in a school setting that have to quarantine. The duration for quarantine is typically 14 days from the point of exposure, although there are 2 ways to shorten that. Number one, you can shorten it to 10 days straight up with relative safely, and we endorse that. Number 2, you can shorten it to 7 days and get a negative test on day 5, 6, or 7. So there are ways to shorten that quarantine period. For this school year to date, there's been about 22,600 positive cases of COVID amongst K through 12 students, and an additional 3,600 in staff. What is encouraging to me when we look at our K through 12 data is for every positive student case, there's an average of only 2 close contacts identified in the K through 12 setting. That's a pretty low number, and that tells me that schools have done a good job of following all the guidelines that have allowed them to keep kids in school safely. And also interesting, if you look at other southern states, particularly Alabama and Mississippi, Louisiana has had significantly less school disruptions. And I mean significantly, 10 to 20 times less the number of school disruptions, particularly because schools have done such a good job with that guidance. This is important because COVID does affect children, and it affects children's families. And with 18 months of experience with this pandemic, there's absolutely no question about that. Just in this Delta surge, we had 9 childhood deaths of COVID. 18 childhood deaths from COVID throughout the pandemic as a whole. We've had 269 cases of multisystem inflammatory syndrome in children. This is a severe disease. 3 of those cases are still in the ICU, still critical. I'll be clear that although there is more autonomy now to schools, and that is an appropriate measure reflective of the improving numbers throughout the state and the slightly abating crisis, our public health recommendation, our clear and evidence-based public health recommendation, is for schools to continue enforcing masking within their environment and to continue following the evidence-based quarantine guidance from the CDC. As the governor said, we have the opportunity, will likely have the opportunity within a couple weeks to extend the ability to get vaccinated to kids as young as 5, and that's an encouraging proposition. The FDA Advisory Committee is meeting right now, today, to talk about this. That's an open and transparent meeting. The FDA will rule on whether or not to authorize the Pfizer vaccine in children down to the age of 5 in the coming days. The CDC Advisory Committee is slated to meet next week, and we could be offering vaccine to children within 1 or 2 weeks. So that's very, very exciting. That's another way to reduce school disruptions, because once a child is fully vaccinated, then they no longer have to quarantine if they were exposed, as long as they remain asymptomatic. Of course, there's many other benefits to being vaccinated. That kid has lower chance of getting sick, and that kid has a lower chance of bringing that virus home to their family, which we know happens, unfortunately. So very encouraged that it looks like in the near future, vaccines will be available to younger children. And if anyone has questions about the data behind this, these committee meetings happening, the FDA committee meeting today and the CDC advisory committee next week, these are all public, all transparent. You can watch them online. You can download all the materials. It's proceeding in a very transparent way. It's pretty exciting to watch. Go to the next slide for a second. I'll talk about booster shots because there's been news over the past couple weeks, and it might get a little bit confusing. At this point in time, all 3 vaccines have booster shots that are available to many, if not most of their recipients. So I'll walk through what those criteria are for the 3 different vaccines. I'll tell you, to date, there's been 166,000 people in Louisiana who have received a 3rd dose or a booster shot. It's about 8% of everyone who's fully vaxxed in Louisiana. If you look at just people 65 and above, it's 20% of that population. For Pfizer, you are now eligible for a booster shot if it's been 6 months since you completed the series, meaning 6 months since you got that 2nd dose, and either you are 65 and above, in which case I very, very strongly recommend you get boosted, or you are 18 and above and either have an underlying condition that puts you at increased risk, and that list of conditions is quite large, or you live or work in a setting that is high risk for exposure, meaning you live in a congregate living facility like a nursing home or a shelter, or you work on the front lines like a teacher or a grocery store worker, or many other professions that put people on the front lines. And I'll add that there is no verification requirement, so people simply have to self-attest verbally that they fit one of those 2 categories. If anyone has questions about whether a booster shot is right for them, what their risk-benefit calculation is, please talk to your doc. It might be different for everyone. If you go to the next slide, the eligibility for Moderna is essentially the same as Pfizer. If you are 6 months out from getting that 2nd shot, you're eligible for a booster, number 1, if you're over 65. Number 2, if you're over 18 and you have an underlying condition, or number 3, you're over 18 and you have a high risk for exposure by virtue of your living situation or your employment. For Johnson & Johnson, you are now eligible for a booster if 2 months have eclipsed since when you got your dose. Remember, Johnson & Johnson is that 1-dose series. Like the other 2 vaccines, that protection does wean a little bit over time. If you are more than 2 months out from your Johnson & Johnson dose, which many people are, you are now eligible for a booster shot as well. Booster shots are important to maintain the protection for people who have already been fully vaccinated. But I'll be clear, and the governor was quite clear as well, the primary objective is to encourage more people to get vaccinated in the first place. That's going to be what helps prevent us from having future surges. And I want to talk a little bit more about that. If you can go to that last slide there. This is a graph that is, it's actually just cut from the CDC's data tracker, and it's a new feature they put up there. And I really like it. I'm actually going to encourage people to spend some time on the CDC's data tracker looking at this. You can look at the rates of COVID-19 cases and deaths by vaccination status, and you can filter it between different vaccine types and different age groups. We have filtered it here for just COVID-19 deaths by vaccination status, all ages, all vaccine types. The black line on top is unvaccinated individuals who right now are dying from COVID at a rate of 9.14 per 100,000 people. The blue line on the bottom is vaccinated individuals who right now are dying from COVID at a rate of just 0.74 per 100,000 individuals. It's pretty stark, the difference in protection that you have, your risk of dying from this virus if you're vaccinated versus unvaccinated. It's pretty stark, and that protection only becomes more stark when we're surging. You see how much greater that protection is when we are in a surge over the past couple months there. Throughout this Delta surge, and I'm counting back to essentially the beginning of July, we've lost over 3,700 Louisianans. More than Katrina, more than 9/11. 3,700 Louisianans just in this Delta surge. 14,496 deaths total. I'll tell you, there was an NIH report that came out just a few days ago that showed for every 1 in 4 COVID deaths, a child loses a parent. 1 in 4 COVID deaths result in a child losing a parent. And so if your concern is for the safety and well-being of our families and of our children, the best thing you can do for them right now to protect their future is to get everyone around you vaccinated. It's just as simple as that. I'm going to read actually verbatim just for a second from this NIH report. One paragraph that really struck me. Children's lives are permanently changed by the loss of a mother or father or grandparent who provided their home basic needs and care. Loss of a parent is among the adverse childhood experiences, or ACEs, linked to mental health problems, shorter schooling, lower self-esteem, sexual risk behaviors, and an increased risk of substance abuse, suicide, violence, sexual abuse, and exploitation. If your concern is to protect children and families, if your concern is to have children back in school and doing well, the best thing you can do now to help ensure that in the months ahead is to get yourself vaccinated and get those around you vaccinated. We will remain vulnerable in Louisiana to another surge until we can get more of our friends, family, and neighbors vaccinated. It's just as simple as that. The governor said that we can't predict the future, and he's absolutely right. As always, it is uncertain here. And I'll tell you, some are postulating that because of the size of this past surge, that we might have enough exposure in the community now to prevent another one. I really want to believe that. I really wanted to believe that when it was said after our third surge, the one in December and January. It wasn't true then. I don't know if it's true now or not, to be honest with you. But what I do know with absolute certainty is the more that we can get our friends, family, and neighbors vaccinated, the chance of a future surge decreases. The governor said it's in our hands, and he's absolutely right. So I'd like people to take stock of the sacrifices, both large and small, that families across the state have made the past few months in this terrible surge, and think about how simple it is to just get vaccinated and get those around you vaccinated, and how powerful that can be in help preventing us from having to go through this all again. I'd be happy to answer a couple questions if there are any. Yes, sir.
What does the data show when it comes to mixing vaccine granting?
Thanks for asking me. I should have mentioned that when I talked about booster shots. The other news is now people have the ability, if they would like to, or if their doctor recommends, to mix or max their booster shots, which means if you got Johnson & Johnson for your shot, you're able now to get either Johnson & Johnson as a booster or Pfizer or Moderna. The data is not conclusive, first of all, because the trials are relatively small looking at booster shots. It does appear to be quite safe. For some vaccines like Johnson & Johnson, it might give a little bit better protection, but I say might because the trials are pretty small on there. So I don't think it's a conclusive thing right now. One of the reasons why it's important is, depending on what your own risk profile is or what your concerns are, it might make sense for you to get a different dose. So for people that have that question, I think talk about it with your doc, but it does give more options, gives more options to people.
Just a quick follow-up.
Yeah.
What about Moderna study that people need to be aware of in terms of their approval booster shot being half of the original dose when they used the full-strength doses in their study?
Yeah, they actually studied a range of doses. There were a number of studies that went into that. They showed pretty conclusively that the immunologic response, the antibody response to a half dose is pretty good. You know, Moderna actually had more mRNA content in their vaccine than Pfizer did anyway. So they did pretty good, showing that you get a half dose, you still get a pretty good immune response. So I feel comfortable with that right now. Melinda? Yeah, it's about 421,000 kids. That's just the population between 5 to 11 in the state. We'll be getting vaccine allotments, very similar to how we did when the vaccines first started getting rolling. The first allotment for us is going to be about 148,000 doses that we'll then distribute to our vaccine provider network in a similar fashion that we did the first time around. I think there's going to be a lot of questions. The data is newer on kids. It's all being talked about in these committee meetings right now. And, clearly, there's no question that the risk to a kid of COVID is not as much as it is to someone who's 70 years old, but it's still significant and still significant to their families. So, I anticipate that pediatricians across the state are going to have a lot to say about this. I would encourage families to start talking to their pediatricians now. I think if a family has an annual checkup for their kid coming up, I think that's a great opportunity to talk about the vaccine, talk about the pros and cons. And I think in a few weeks' time, there's a good chance that that pediatrician would have the vaccine in stock to give it if the family chooses. Yep. Yep. Thank you.
Thank you, Dr. Cantor. I did want to also mention that now is a great time to get your flu shot. In addition to your vaccine or your booster, in addition to looking forward to being able to get your children between 5 and 11 vaccinated, flu shots are available now. Very important that we take advantage of this opportunity to reduce the demand that we're going to place on the same part of the healthcare delivery system that is taxed so heavily when we do have COVID patients in the hospital. And so please make sure that you get your flu vaccine. Before I take questions, we've talked about this before, but I want to make sure you know that later this week I will be traveling to Scotland for the 26th United Nations Climate Change Conference of the Parties. It's referred to as COP26. I don't think there's any doubt about what I'm about to say. There is no state more affected by climate change than Louisiana. But it's also true that there's no state better positioned to be part of the solution and to benefit more from newer policies that move us towards a reduced carbon footprint. And I say that as it relates to the weather, which is becoming, the weather events are becoming more severe and the frequency is increasing as well. But also I say that because of sea level rise and other challenges that we have here. But I also see this as a tremendous opportunity for the state of Louisiana. And that's why I'll be going, along with members of the Department of Natural Resources, LED, and CPRA, to meet with leaders and companies from all over the world. To make sure that they know that we are transitioning here in Louisiana too towards a cleaner energy future with a reduced carbon footprint, to take advantage of all the new and exciting technologies, but also to make sure that investment happens here, economic development happens here in Louisiana, and those jobs get created here as well. We all need for the world to know that the most productive manufacturing workforce in the world, well, I should say in the country. The Census Bureau doesn't do the world, but it does the country, and that's pretty strong, is right here in Louisiana. And we have everything that we need to be a global leader in clean energy. And I think this is how we're going to continue to land multi-billion-dollar economic development deals like the recently announced Air Products project. I know there is a time difference to balance, but we'll be making you aware of our schedule while we are there, including in events that might be streamed. And when I get back, I look forward to sharing with you what I have learned. And with that, we'll take some questions. Yes, ma'am.
Governor, did you speak to Superintendent Romley about your plans on K-12 schools, and what kind of conversation did you have with him in advance?
No, I did not today. Members of my staff did have conversations. I've talked to Superintendent Brumley a number of times about the general direction of what we were doing. And he knew, for example, that back late in the summer before the fourth surge hit, that this was the route that we were going to take in terms of eliminating the mask mandate for the state, but also making it optional for schools. So I know that the conversations happened today. There's nothing in the announcement today that would surprise Superintendent Brumley.
Do you know what the feedback was in terms of his position on whether he supported that?
Oh, I think he supports making the I mean, first of all, you need to let Superintendent Brumley speak for himself. I'm always hesitant to do that, even if I have a direct conversation. But I have every reason to believe he supports making the mask mandate optional by school district or by each non-public school entity. Yes?
Administration received any word on how much Louisiana received from the supplemental?
Yes. Yeah, we did today. So you're talking about the supplemental disaster appropriation that Congress passed several weeks ago, and it's a little bit tricky because the supplemental included $5 billion total, but that was for 2020 and 2021. But the way they did it, there was a $1.61 billion floor for all of the storms of 2020, which includes Southwest Louisiana, Laura, and Delta. And the amount of funding that we've been allocated is $594 million, right, a little less than $595 million for community development block grant funding that'll flow through HUD for that storm. Quite frankly, we're thankful that we got it. It's taken a long time. It is not, in our view, sufficient to effect a full recovery, especially as it relates to housing. And we will continue to work with our congressional delegation, other members of Congress, and the administration. We know that there will be additional opportunities coming up. I think December the 3rd is the date by which Congress has to take additional action with respect to appropriations to keep government running and so forth. And so we will be going back, both as it relates to 2020, to get additional funding for Laura and Delta, but also to make our case as it relates to Hurricane Ida, which everyone understood that the $5 billion appropriation, the way that they apportioned it, that was just going to be a down payment on the Hurricane Ida recovery efforts. I do want to make sure that everyone understands the allocation was announced today. That is not money in our bank account. And in fact, HUD still has yet to issue the Federal Register notice, which contains the rules pursuant to which we have to design our program. And we will do that with a state action plan that we then have to send to HUD, get that approved, and upon that approval, that funding will be available. So we're waiting for the Federal Register notice to come out. Don't have any idea when that is going to happen. I can tell you we are already drafting a state action plan so that we can very quickly submit one to the federal government, to HUD, once the Federal Register notice goes out. We continue to work with all the local leaders as well. And what I can assure the people here in Louisiana and the folks around the country and in Washington, we will do everything we can with the money we're given to make sure that there is a complete and robust recovery. But it will be very challenging to do that with $595 million for Hurricanes Laura and Delta, given the unmet housing need alone exceeds that considerably. So we got some more work to do. Yes?
Governor, I've read a new study published by JAMA Health Forum and looked at some vaccination records in a few states, including 19. And it said that state lotteries didn't really motivate people to get the COVID vaccine. Did you guys find that to be true, or what did y'all find about
Yeah.
shot at $1 million, now the shot for 100
Yeah. Restate your question. Did you say?
It was a new study published by JAMA Health Forum.
Okay.
I've seen an article as well. It was saying that the vaccine lotteries may not have actually helped
Yeah.
reduce vaccination rates. Have you guys seen the same thing here, or what did y'all see?
Well, what I can tell you is we had the funding available from the federal government. It could be used for that purpose. We knew that the number of vaccinations was tapering off to a point that caused us great concern. And so we wanted to make sure we were doing everything that we could. I will tell you that when we announced the lottery, and this is going from memory, I don't have it in front of me, you could see a rate of decrease in the vaccinations. We announced the lottery, and then that leveled off, and then actually upticked a little bit. So I think if you compare correctly, you will see that it did incentivize people to be vaccinated, and I can't give you the exact numbers on that. We do know that the shot for 100 seems to help people as well, many of whom intend to be vaccinated. They're not anti-vax. They just, for some reason, they don't find it worth their while to make the appointment. The $100 can make all the difference in the world there. But we did see a leveling off and a slight increase there for a while after we announced the lottery. So we do believe that it served its intended purpose. Yes.
Governor, there's been some criticism about the pace of the temporary housing program
Mm-hmm.
that the state has set up. Can you respond to that criticism? And are you comfortable with the pace of how the trailers are getting to people? And what do people dose up about, their feelings on the program so far?
Yeah, well, I have never, ever been satisfied with the pace of any recovery effort from any storm with respect to any element of relief. And certainly people who are waiting for housing are not going to be as well. And I press that all the time at GOSEP, but with our contractor, Aptum, as well. It's why I make myself available to the parish presidents in the parishes that have been most hard hit. And we are running, and I don't offer this as an excuse, but we're running the first program ever of its kind here in Louisiana in response to Hurricane Delta that allows the state to do non-congregant sheltering involving trailers. And I believe it's going to ultimately be much faster than if we just let FEMA do their temporary housing piece, which they're doing as well, but that takes longer. And there are some things that I'm pleased with. For example, and I think I have some numbers here. I think we've purchased more than 2,000 units now. I know that they've inspected well over 300 locations to put them, individual locations, and a couple hundred commercial or group sites. I think they've got about 190 of those travel trailers deployed now. And now that the systems are in place and the effort is up and running, and it's been, I think, 3.5 weeks or so that we're into it, and that number that amount of time may be slightly off. But the goal is, and what I've been assured will happen, is it's going to ramp up very quickly from this point going forward. So no, we're not satisfied, but what I can tell you is we're doing everything we can to move as quickly as possible. And I'm thankful that FEMA's allowing us to run this program, because I know the relief will be there faster than it otherwise would have been. We continue to have over 5,000 households in shelter with TSA, by the way. A little less than 16,000 individuals. The congregant shelters down to 51. I think we have 2 shelters open with a total of 51 people. So there are multi-efforts around non-congregant sheltering, TSA being one of them, and then the program that you mentioned being another one of our efforts. But no, we're not satisfied. We're going to keep moving faster, just as we're able to do it. Yes.
Governor, sort of ending on the mask mandate, would you consider reinstating another mask mandate in the future if we go through a similar surge like what we saw a few months ago?
Yeah. I think it would be a terrible mistake to announce today that no matter what happens in the future, you're not going to do that which has been proven effective at reducing transmission and helping you to get through a surge without the maximum number of people contracting COVID and going to the hospital and dying. And so that would be a terrible mistake. I'm not going to make that mistake. It is my hope, my fervent hope, that we won't have another surge. But it could happen, and we know that it's more likely to happen if too many people remain unvaccinated. We know that the Delta variant was more contagious. Do you know that there won't be another variant that comes out that's even more contagious than Delta? We can't know that. And so I think it would be a tremendous mistake to ever take any common sense proven mitigation measures and say we're never going to do that again, regardless of what happens to cases and to hospitalizations. And if you, well, let me say it a different way. The health care providers in Louisiana, particularly our hospitals, our nurses, our doctors, our respiratory therapists, they were taxed incredibly when we had 3,022 people in the hospital at one time. And those are just people in there for COVID. They're rendering care for people in there for all sorts of reasons. And it literally looked like a combat zone. And you never want to get to there or get worse if there's something you can do to prevent it. And so why would it make sense for anybody to say, no matter what happens in the future, we're not going to do those things which have been proven to be effective in the past? So yeah, we will. I hope we won't need it, but I won't hesitate to do it if we do. Look, thank you all very much for continuing to cover this. It's incredibly important. And I want to again thank all the healthcare providers I just mentioned and so many others, EMTs and paramedics and you name it, for being true heroes throughout. And I know we still have over 300 people in the hospital. We're still announcing double-digit deaths every single day. So there are families whose lives are absolutely upside down today because of COVID, whether it's because they or a loved one has it, whether they've just lost somebody, whether there's somebody in the hospital or you're actually taking care of a patient. So this pandemic is still with us. I am thankful, very, very grateful that we are in a much better place than we were a few weeks ago. And we're there because of the people of Louisiana. And so I did want to make that comment once more. And I do encourage everybody to lift our state and one another up in prayer. So that we would have more unity and less division, and that we can get through this pandemic as soon as possible and in the best possible shape. So thank you all very much, and God bless.